For a long time, I felt lethargic and irritable, as if my vital energy was slipping through my fingers. I couldn't shake the feeling that something was wrong with my body, and that's when I came across an article about magnesium. It seemed like a solution to all my problems: better sleep, reduced anxiety, a surge of vitality. But it turned out, as with everything in our body, it's not that simple. I had no idea that an ordinary supplement, praised by everyone, could turn into a real trap. The first thing I encountered was completely unexpected. I started taking magnesium because I heard it helps you relax. But just a couple of days later, I noticed that my stomach seemed to have gone out of control. Everything I ate passed through me too quickly. At first, I thought it was just a coincidence, but then I decided to check the composition of my supplement. It contained magnesium oxide. This is the cheapest form, and, as I later learned, it is barely absorbed. Everything the body can't use, it simply flushes out, and in the intestines, this excess turns into a laxative. I imagined how salt draws moisture out of a cucumber. That's how magnesium pulls water from tissues, resulting in digestion that becomes too rapid and watery. I had to find a form that didn't irritate my stomach. Magnesium glycinate turned out to be much gentler. With it, I finally felt the difference without constant trips to the bathroom. But that was just the beginning. I thought that with magnesium, I would finally achieve health, but one day, I noticed my heart started beating strangely slowly. I didn't pay much attention until I read that an excess of magnesium can slow the heart rate almost as much as a deficiency. It's like imagining a car. Calcium presses the gas pedal and magnesium presses the brake. If there are too many brakes, the car just stops moving. My heart seemed to have lost its rhythm, and I realized you can't just arbitrarily increase the dosage. It turned out that a magnesium overdose could lead to bradycardia, a condition where the heart beats much slower than normal. This was a real revelation. I wasn't experiencing a magnesium deficiency, I had simply overdone it. Then I faced another problem that no one had warned me about. I've always suffered from high blood pressure, and of course, magnesium seemed like the perfect solution. It has a relaxing effect on blood vessels. But one day I took a slightly larger dose, hoping it would help me relax before bed. A few minutes after I got up from the couch, a wave of dizziness washed over me. I almost fell. In that moment, I understood that my blood vessels had relaxed too much. My pressure dropped sharply, and my brain simply didn't get enough blood. The feeling was frightening, an emptiness in my head, weakness in my body, a fear of fainting. I didn't even know magnesium could affect blood pressure so strongly, especially if it's already not too high. Later, I noticed that my mental clarity had become much less sharp. I took magnesium in the evenings to sleep better, and indeed, my sleep became deeper. But the more I took it, the more I felt it was hard to focus during the day. I could sit and stare into space, not understanding what I was even doing. Even simple tasks seemed overwhelming. I couldn't concentrate. Talking became difficult. My brain seemed to be immersed in a fog. Mornings were particularly hard. I would wake up completely exhausted, even though I had slept for a long time. For elderly people, I thought this could be dangerous. Slowed reactions, constant drowsiness, risk of falls. Magnesium does affect the nervous system, but too high a dose can literally switch it off. But perhaps the most unexpected discovery was the hidden interactions of magnesium with other medications. I've been taking thyroid medication for a long time, and I suddenly learned that magnesium can interfere with its absorption. It acts like a magnet. It attracts the drug molecules, and they simply don't reach the necessary receptors. So I was strictly following the doctor's prescription, but the effect was zero. The same thing happens with iron and zinc. Magnesium interferes with their absorption, clogging all the pathways in the intestines. I imagined it like a traffic jam on a highway. All the minerals are lined up, but magnesium is taking up the whole road. But what amazed me the most was that magnesium can be deadly for people with kidney problems. If the kidneys aren't working properly, magnesium accumulates in the blood. This can lead to hypermagnesemia, a condition where its level becomes toxic. The symptoms are terrifying: weakness, slowed pulse, a sharp drop in blood pressure, and in extreme cases, cardiac arrest. I realized that before starting to take such a supplement, you must definitely consult a doctor, especially if you have heart disease or unstable blood pressure. Now I understand that magnesium is not just a useful supplement, but a complex tool that needs to be used wisely. It can indeed help improve sleep, reduce anxiety, alleviate symptoms of type 2 diabetes or migraines, but only if you know for sure that you are deficient in magnesium and if the dosage is correctly chosen. I had to go through many unpleasant sensations before I understood how important it is to listen to your body and not blindly believe advertising. I remember once deciding to try magnesium late in the evening, hoping it would help me fall asleep. I took a pill after dinner, not thinking that the food contained products rich in calcium and iron. In the morning, I woke up exhausted, even though I had expected deep, restorative sleep. At the time, I didn't yet know that magnesium could interfere with the absorption of other substances, and vice versa. Certain minerals could reduce its effectiveness. This turned out to be particularly sensitive in the case of my thyroid medication. I was taking it in the mornings as prescribed, on an empty stomach, and then almost immediately taking magnesium. It turned out to be a big mistake. Magnesium and thyroid medications don't get along. It prevents them from entering the bloodstream. The medication literally passes through the body in transit without having time to take effect. I didn't immediately understand why my symptoms had flared up again, even though I was strictly following the dosage and schedule. Only later, when I started studying the topic more deeply, did I find an explanation. It's all about the substances competing for the same pathways in the intestines. Iron, zinc, magnesium. It's like they have a common road, and if one of them occupies all the space, the others don't stand a chance. It's as if 3 buses were trying to enter one narrow street at the same time. When I started taking magnesium in large doses, I thought I was only doing myself good after all. More is more effective, right? But in practice, everything turned out differently. I started feeling tired, even though I was sleeping enough. My immunity weakened. Colds started coming, one after another. Later, I realized these could be signs of iron and zinc deficiency. Magnesium, by clogging the absorption channels, was preventing them from entering my body, and without even noticing, I had deprived myself of crucial elements. Magnesium turned out to be especially dangerous for people with weakened kidneys. I started reading stories on forums. Some users shared how their condition sharply worsened after taking magnesium supplements. The kidneys are a filter that is supposed to remove excess from the blood, including excess magnesium. But if the filter is clogged or damaged, magnesium starts to accumulate. This condition is called hypermagnesemia, and the consequences can be frightening. I read about cases where people developed serious heart problems. Their blood pressure dropped to critical levels, and it all ended in hospitalization. One person even described how his heart stopped. They managed to resuscitate him, but he barely survived. It was a sobering thought. I began to understand that magnesium is not a harmless pill for fatigue or insomnia. It's a powerful substance that can both help and harm. People with low blood pressure or heart rhythm disorders need to be especially careful. Magnesium relaxes blood vessels, and if your pressure is already unstable, you can get a dangerous effect: fainting, dizziness, even arrhythmia. But strangely enough, despite all these risks, there are cases where magnesium truly works wonders. I remembered once waking up with a leg cramp. The pain shot through my whole body. It felt like the muscle had tightened into a steel knot. At that time, I wasn't taking magnesium yet, but after consulting a doctor, I decided to try it. He selected a dosage and a form for me, not oxide, but citrate, which is better absorbed. After a couple of weeks, I noticed the night cramps had disappeared. I started falling asleep easier, waking up more rested in the morning, and even my anxiety during stressful times felt reduced. Later, I learned that magnesium plays an important role in regulating blood sugar levels, especially in people with type 2 diabetes. It helps cells absorb insulin and reduces inflammation. The same goes for migraines. Some types of headaches are related to magnesium deficiency, and with correct therapy, it can significantly reduce the frequency of attacks. The important thing is that all of this only works under a doctor's supervision. Without tests, without understanding your baseline mineral levels, it's like walking in the dark with a blindfold on. Now, I try not to take anything just because it's good for you. I no longer believe in universal supplements or magic capsules that promise to solve all problems. My body is a system where everything is connected, and any intervention requires precision. I've learned to ask myself, do I really need this? And what will my doctor say? Only then does the decision become conscious. I remember hearing a middle-aged woman arguing with a pharmacist at the pharmacy. She insisted she needed magnesium because her blood pressure was jumping. The pharmacist cautiously tried to explain that in her case, it could be dangerous, but the woman was sure she had read online that it helps. I wanted to intervene, but I realized that persuasion is useless in such matters. Everyone must go through their own path to understanding. I went through it via sleepless nights, dizziness, strange sensations in my body that only disappeared after I stopped the uncontrolled intake. Now I know that magnesium is not just a mineral. It's like a neurosurgeon's tool in skilled hands. It can save. In unskilled hands, it can harm. And before I reach for a jar with a pretty label, I always ask myself, am I sure this is what I really need? Those sleepless nights when I tossed and turned in bed, remembering every step I took, every capsule I swallowed, taught me the main thing: our bodies do not forgive carelessness, especially when it comes to complex elements like magnesium. I learned that it can affect not only my condition, but also how other substances are absorbed. For example, iron and zinc. I didn't understand right away why I suddenly felt lethargic, why my nails were breaking, and my hair was starting to fall out. It turned out that due to an excess of magnesium, other important minerals simply weren't reaching my blood. And then I met Marina. She was always cheerful, fit, and I asked asked her what her secret was. She admitted that she had once ended up in the hospital with a serious diagnosis, hypermagnesemia. She had kidney problems she didn't know about, and it all started with simple leg cramps, which she decided to address by taking magnesium on a colleague's advice. It took her a long time to recover from that incident. Heart problems, blood pressure issues, the fear of falling into a coma, all because her kidneys couldn't handle removing the excess mineral. After her story, I started paying special attention to my test results. Every 6 months, I checked not only a complete blood count, but also my levels of microelements. Once a doctor said I had a mild magnesium deficiency, but added, "Don't rush for the jars. Try food first." And I started with the simple things: green vegetables, nuts, buckwheat. I tried not to go to extremes, and since then, every time I consider taking supplements, I first ask myself, does my body really require this? The doctor explained that magnesium affects not only muscles and nerves, but can also subtly interfere with the absorption of other vital substances, for example, iron and zinc.